welcome. You're listening live to Heart-to-Heart, a program which aims to help you understand and to become your loving self at KMET 1490 AM ABC Radio Live. I'm Dr. Mitra Rashidian. I'm a licensed marriage and family therapist and a certified sexologist in full-time private practice located in beautiful Encino, California. And I'm here today along with my business partner, colleague, and my very good friend, Dr. Robert Jaffe, who's also a psychotherapist and a certified hypnotherapist. And he's going to be giving us information and education and insight about trauma, addictions, codependency, and all impacting relationships. And he will further describe the program for all of us. Welcome, Dr. Jaffe.
Thank you. Appreciate the welcome and the nice introduction.
My pleasure.
And you as well. You're my wonderful friend and colleague and partner and
Thank you.
And light. You're a light in my life. So thank you.
Thank you.
Yes. So codependency. We talk a lot about that in this hour.
Or we can't talk about codependency enough.
No, we can't talk about it enough. It is. We have said that it is the most common. It's the most common addiction, and it is the most unrecognized addiction. And the reason that it's unrecognized is because it is. If you want to use the word normal. Which is sort of a no-no in our profession. We don't actually say normal.
Yes.
But if you want to use the word normal, normal really means common. And so codependency is more normal than loving, authentic, true relationships, unfortunately. And that's because of where we are as a species, as human beings. In our development, I think if you look back in history, what you see is that we come from a history of might makes right. And might makes right simply means that the people who are the stronger physically, and the stronger with money and power, those are the people who get their way. And so when you're talking about might makes right, what you're also saying is that people are not equal in relationships. They're not the orderly is not equal in importance to the nurse, and the nurse is not equal in importance to the doctor.
Right. And boy, we see that a lot in society.
Yeah.
You know, that division that we human beings create among ourselves based on the external factor of the person,
right?
Such as level of education, such as the level of wealth,
right?
And type of lifestyle, and the color of his skin, and the differences that we all physically have. Or that. So these are all the divisions that we make. Actually,
these are all divisions that we make,
and we give each other, that false selfhood that people live with. That that's such an important topic. Maybe one time we need to talk about this.
Well, yeah, I think it's important because seeing other people as equal, I think, is a big issue, and what happens then is that division of power begins in the family of origin.
Yes, absolutely.
And so do our parents each have equal power within the family? And if you look at it, and you look at it honestly, you will see that often they do not. Often one person is more dominant than the other. And often, often there are power struggles within the family. And when we grow up and we observe power struggles, that affects how we feel about ourselves and how we feel about other people. the messages that we get about who men are, the messages that we get about who women are, the messages that we get about what relationships should look like. Those are all very powerful messages, and we are we are in the process of well, I'm going to say finishing our book. We still have a ways to go,
Right.
but we've been working on our book for about 2 years. You mentioned it in the last hour. At the end of the hour, it's called "Not Tonight, Honey. I Have a Headache," and in that book we talk a lot about men and women's relationships. And one of the things that we talk about and we go into detail about is the issue of codependency.
Right.
And what codependency means is that there is a belief within the couple that it's my job to make sure that you're happy. And if both people struggle with that, then I am always looking for your approval because that validates me. I feel like if I get your approval, then I'm a good person or I'm a good partner. And if you're struggling with it, then you feel the same way. If you get my approval, then you're a good person or a good partner. And to the extent that we hold on to that belief is to the extent that we sabotage our own authentic true selves, because it's more important that I get you to like me than that I'm able to be who I really am.
Exactly. Yes. Because the idea of, liking me, it's a need that, we didn't get that during our childhood.
Correct. Correct.
Right. So
Yeah.
we're looking for that one person to like us.
Yes.
We do everything for the person to like us. Right. Some people become very creative and they come up with ways to get the attention and for the person to like them. And then when that doesn't happen, that's where, another trauma starts.
Yes, exactly. So when we talk about codependency, we're talking about people who haven't matured according to their age.
Right.
Emotional maturity is an interesting thing because in our society, we measure success more monetarily than we do emotionally. So we look at other people, and in order for other people, in order to be successful monetarily, you don't really need emotional maturity.
Right.
Right.
Yes.
And so if you say if I'm successful, you're usually referring, and most people are referring to their monetary worth. Right. I'm successful because I have a 10,000 square foot house in Malibu. I'm successful because I have this 10 carat diamond ring on my finger. I'm successful because I can send my children to the best schools. And so when success is measured in that way, and I want to say that's not in and of itself a negative thing to think that if I'm doing well financially that I'm successful. But if you say that is the most important or even the only way that success is measured, then I think what happens is you are leaving yourself open to having a lot of pain and disappointment in your life because your relationships are not measured by monetary success.
Well, what you're saying is exactly accurate. In theory, yes, and we see that many people do not know how to apply that theory to the real life. I see couples that they come in and their measure of success is based on the size of their house.
Well, it's monetary.
Yeah, and then they go specific in that monetary part actually plays, a big role, if not the biggest role in their life.
Exactly.
In terms of, what success means to them. And then when there is a competition between the couple, that's where it gets really more serious even, right? And we learn this attitude as we grow up. I mean, these parents say, look, so and so, look, they're going to this nicer school or to this nicer, university. Look at their car. Oh my God, look at that house. Oh my God, look at that outfit. So even without parents wanting to teach that monetary concept to children, right? When they reflect on something that's believed to be better than what they have, the child learns it, that I need to look at something better than what I have in order to become better and in order to become successful.
Right.
So if they see somebody's wearing a ring on their finger, let's say it's 2-carat diamond, they're looking for the 3-carat diamond.
Well, you're talking about feeling competitive.
But they become competitive.
Yes.
I mean, competition is part of what is known to be having a successful life, right? So everybody is going to gain something extra than the next person, than the person that they are next to them.
What you're talking about is what is commonly accepted.
What is commonly accepted, and that's how people, some people actually live that way.
I think most people do live that way.
Yeah. It's like a rat race in society of who makes it more.
Right. And so, going back to codependency, when pleasing your partner is more important than being authentically yourself, then you lose connection with your authentic true self.
Right.
And you're busy trying to please your partner is busy trying to please you, and so your measure of success in the relationship is how happy your partner is with you. Right. And so then you have a vested interest in keeping your partner happy, and a vested interest in making sure that your partner does not express unhappiness with you. If you're codependent and your partner says, I'm upset with you, it feels like the end of the world.
Yes.
Yeah. And what that means is your partner then has to not tell you their truth, that they are upset with you, or get upset with you, which then makes you feel like you're not doing your job well, makes you feel unappreciated, and then you often turn it against your partner. And if you're upset with me, that I'm upset with you because you're upset with me.
Right.
And then we're in this back and forth state, which is what we call codependency.
Right.
I'm measuring my worth based on my ability to make you happy.
Exactly.
And we will continue talking about this because it's very important. We really want to hear from our audience. Please call us 951-922-3532. Let us know your thoughts. Give us some examples, and we will return.
Welcome back from our commercial break. This is Heart-to-Heart program at KMET 1490 AM, ABC News Radio Live. For those of you who are just joining us, we're talking about codependency, addictions, trauma impacting relationship with Dr. Robert Jaffe and myself. And we would like to hear from you. So please call us at 951-922-3532. And please introduce this program to those that may benefit from the information that we are providing. And if you don't feel comfortable contacting us online live, please call us or email us via our private contact information. And we appreciate the fact that you're choosing your hour to be with us. We thank you. We know you have many choices, and thank you for choosing us. Dr. Robert Jaffe, you were talking about codependency, trauma, addiction.
We're talking about codependency, and so where we left off was What is the difference between and how can people recognize when they are codependent, and what exactly is that? So the beginning part of codependency means that we are born into a family and a society where the child's needs, the child's healthy needs, are not being met. Um, Either they are not being met, uh, or they are being exposed to abuse. Abuse is a step further than neglect, but it's still basically the child feels as though they're not understood, and they're being controlled by their parents. In order for the parents to feel validated, the child then has to serve the parents' needs rather than the parents serving the child's needs. So that's what happens. These are parents, and this is pretty common throughout our culture. These are parents who have some of their own inadequacy feelings, and these inadequacy feelings that the parents have is from their own childhood. And then you can go back in time to the grandparents and the great grandparents, and ultimately, uh, the person that we're talking about now has been born into a family where the parents themselves struggle with feeling good enough. And the child then is raised by parents who project that not good enough feeling onto the child. And as a result, the child themselves struggle whether they are good enough. The child's logic is, if I was good enough, I would feel happy. And if I'm not feeling happy, that's a reflection on my worth. And so that's the child's logic. Um, the child, because they're a child, cannot take care of themselves. You have an infant. The infant, of course, has no ability to take care of itself, and if left alone, will die.
Yes.
And then, of course, even when the infant is not an infant, if the infant is a year old, if the infant is 2 years old, if the infant is no longer an infant, if the child is 3 years old, 5 years old. We live in a society and a culture where it takes a long time for the individual to learn how to take care of themselves and has the ability to take care of themselves. So if the child doesn't learn how to take care of themselves, because the parent can't teach them how to take care of themselves, uh, the child begins to feel afraid that something bad is going to happen. The reality is something bad has already happened, but the child is living in a reality that says that something is going to happen, and the thing that they're afraid is going to happen is that they are going to be abandoned.
Right. Again, sense of safety.
Their sense of safety is at risk.
Right.
And so if the child feels that they're going to be abandoned to the child is the same abandonment that can happen to an adult if the adult is going to the North Pole and hires a dog and sled and a guide, and the dog and the sled and the guide take the person to an igloo, and the person sleeps in the igloo and wakes up and sees that the guide and the dog and the sled are gone, and they walk out of the igloo and all they see is white. There's no way they can survive. They weren't raised in that environment. They don't know what to do. They will die. That's the same feeling that the child experiences when they have a fear of abandonment. So the child will do anything that they can to avoid that fate and to avoid those feelings. And so codependency means that the child then has to please the parents and meet the parents' needs in order to feel safe enough that they're going to survive. that is the beginning of codependency. And as the child grows older, the child may learn coping skills on how to survive in the world without actually recognizing that they themselves are competent and can survive without other people taking care of them. So they look for somebody to be a substitute parent. And they find somebody who will be a substitute parent, and the person who will be a substitute parent is a person often of the opposite sex. It doesn't have to be. It can be of the same sex if you're talking about homosexuality. But you find another person who also struggles with the same issue and wants to make that person, the other person, into their parent. And so, of course, all of this is subconscious. People don't recognize that they're doing that, but they become attracted to other people and who they believe can parent them better than they can parent themselves. They begin to rely on that person, and so it's up to the person to make sure that their partner is okay, just as they had to do with their parents to make sure that their parents were okay, so that the parent can then turn around and be okay for them.
This is a very important point that, that you have brought up. In my practice, in particular, I see that within female partners,
Mm-hmm.
that when they come in and they feel incapable of even handling a checkbook,
Mm-hmm.
and they believe that without their husband they cannot survive.
Mm-hmm.
And in many cases, I see that their spouse, their husband, their partner is actually, looking for somebody like that so
Mm-hmm.
that they can enforce their power there,
Mm-hmm.
and therefore make their wives feel even more incapable of handling things, and therefore creating more dependency
Mm-hmm.
within themselves,
Mm-hmm.
right?
Right.
And then I have been working with several couples like that, and when I ask the female partner what makes them believe that they are not able to, for example, even going to grocery shopping by themselves,
Mm-hmm.
and why do they need, what makes them then to have the need to have their husband next to them every time they want to step outside the house, or even making small decisions within the house,
Or to have
right?
their husband do it for
Or
them.
the husband do it for them,
Right.
exactly. And they don't have an answer for it.
Mm-hmm.
Say, I don't know, it's always been like that. I could never trust myself that I can do anything right,
Mm-hmm.
right?
Mm-hmm.
So at that point, who's talking? Are we talking, is it a mature woman, an adult woman is speaking, or is it a child speaking?
Right.
You know?
Right. And of course, because you're looking at an adult woman, the woman can be in her 20s, 30s, 40s, 50s, or even 60s or 70s. You're looking at her. She looks her age. She has an intellect of her age. She doesn't talk like a child. She talks like an adult, but yet she expresses fears that are that are that are not that normal. No, I'm not going to say normal. That mature adult women don't have.
Mhm.
So obviously she's not mature emotionally, and but our society does not really require that we are mature emotionally. Anyone is allowed to get married in any state if they meet the age requirement,
Right,
and
exactly.
anyone is allowed to have children. Pretty much almost regardless of the age requirement, we have children having children.
Exactly,
Yeah,
yes. Yeah.
and so it doesn't matter what the emotional maturity level is. There's nobody to test it. There's nobody to regulate it. Uh,
There's
that of
nobody to
course,
educate it.
nobody to educate it.
Yes.
So what we have is people who are emotionally immature, having children, and those children then grow up without their emotional needs getting met. They're emotionally immature themselves, and then the cycle continues, right? So the fear of abandonment is usually at the core of most addictions, and I'm going to say is at the core of codependency. The belief is that I can't do this on my own. And therefore, if my partner is upset with me, I really have a hard time dealing with it. And I do anything that I can to make sure that my partner is okay with me. Sometimes I'll get into deep fights with my partner, but underneath there's this scared child. And so we can have these big knockdown, drag out fights, but we need to make up, and we need to make up quickly, so that neither one of us are walking around feeling as though we are inadequate uh, 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 children who are walking around feeling as though we're about to be abandoned and will be left to die. Now, that being said, all of what we're talking about is subconscious.
Yes,
Yeah.
absolutely. Yes.
So people go into therapy and they talk about these fights that, from a therapist's point of view, are ridiculous fights. One of my clients was talking about a fight, a big knockdown, drag out fight, because he used the wrong trash container. One trash container was for the recyclables, and the other one wasn't. And I told him 1,000 times to use this one, and can't he even get that right? And now they're off and running but it has nothing to do, of course, with what they're with the trash can. It has to do with the emotional maturity that they're bringing into the relationship, that then serves to act as as fuel for the fighting. Um, The other thing that happens in codependency is, and we've commented on this, is that the children have a lack of healthy role models. The parents, because they grew up with parents who weren't mature and projected. When I say projected, that means that the subconscious fears that the parent has get projected onto the child. In my case, for example, my father would always say to me, "You have to be able to make a living." Well, what does that mean? And what does make a living mean, right? That was never said, but that was my dad's subconscious fear, that he wouldn't be able to make a living. He always made money, and he did pretty well with that, but he still carried that fear inside of him that he wouldn't be able to. And if he said that to me once, he said it 10,000 times. Well, what did that do to me? It was like, if it's something I have to do, then what if I can't, right? So then I had the fear. Okay, what if I can't do that?
Right.
And so his fear of not being able to make a living got projected onto me. Um,
I mean, I can see that, for example, I have a couple that the wife's mom, she's always has been afraid of being alone or staying home alone or anything that she had to do alone.
hmm
So every time, the husband has to go to a, business trip or one thing, and the wife is home by herself and with children, the mom comes into the play. Oh, what are you going to do by yourself alone? How do you want to handle being alone?
hmm
And the wife has really gotten the idea that, being alone is something dangerous,
hmm
that she can't really stay alone, that she needs
Right.
to have somebody staying with them at the house. It's like, the whole world is just waiting for her to be alone so that, she can be attacked and the
hmm
children can be attacked.
Right.
So guess who goes to rescue?
hmm
The mom.
Yes.
The mom goes there, and she stays with her daughter and the
hmm
grandkids until the husband returns.
Right. Right. Yeah, exactly.
Yeah.
That's a perfect example. Um, so what happens when the parent feels inadequate and the child then also feels insecure because they see that their parent is struggling? The child then does whatever they can to help the parent. They will turn themselves into a pretzel to help the parent, because the fear of abandonment forces us to do whatever we need to do in order for us to feel safe. And so it becomes our job, and then the child becomes what we call parentified in the therapist lingo. The parentified child means that the child has to be the parent to the parent in certain ways, not in all ways, but in certain ways. And when the child is parentified, what that means is the child does not get to be a child. The child has a heavy responsibility. My mom had some serious emotional issues, and my father idealized his mother, and
30 seconds.
and idealized mothers. So my father said to me, "You have to understand and take care of your mother."
Right.
And so I became parentified, and as a result, didn't get an opportunity to go through my own maturational processes when I was a child, and had to do that later in life. So now we just got notified. We're about to go to another commercial. Please stay with us. We love having you, and we will see you in a few moments. And we will continue our discussion about codependency, trauma, and relationships.
Exactly.
3 p.m.
Welcome back from our commercial break. This is Heart to Heart program at KMET 1490 AM ABC News Radio Live. We're talking about codependency, trauma, relationships. And please call us at 951-922-3532. And we would love to hear from your experience, how you have been able to manage your program, and your stress level, or your anything that you believe now after listening to our program may come across as codependency. So yes, what?
No, that's true. So yeah, we're giving you.
Carry on, please, Dr. Jaffe.
No, we're carrying on. We're talking about this, and it's very interesting. We would love to hear from you because we're giving you information, and we're hoping that the information that we're giving you is valuable to you. But we can't be sure if we don't get feedback. So we would love to get feedback from you and find out, if we're talking about things that are of interest, and if not, we would love to hear what would be of interest, because this program is for you.
Right.
Um, so we talked about what creates codependency, um, and that the parents inside feel inadequate, that gets projected onto the child. The child then gets parentified, meaning that they have to parent their parents. They have to turn themselves into a pretzel in order to please their parents. And then they grow up, and then they select people in their life who they think that can parent them better than they can parent themselves. That's the way it works. What happens is that in order for us to understand who we really are, we need to understand our emotions. Um, what comprises a human being is the person's spirit, the person's emotions, and the person's intellect,
Right.
right? And of course, the person's body. All those four things. So the body, we're not here to talk about today. The body just pretty much does what it's going to do, and the intellect is a different part of the brain. So we can learn something intellectually, and it doesn't affect our emotionality, and we can learn something emotionally, and it doesn't affect our intellectuality. So we can. So what we have to learn to do then is to recognize that becoming mature means that all the parts of us are growing. Um, our bodies obviously will grow. Intellectually, we can learn new things, and we can have new talents and new abilities. And spiritually, our recognition that we are more than our bodies, that we carry within us an energy, and that energy is our spirit, and that spirit is eternal. You can disagree with that, but that's what we're saying here. And then the emotionality, which is the field of psychology, mostly, has to do with emotional maturity and the ability to handle our emotional reality in a way that's healthy for us. And what happens in a family that does not pay attention to the child's emotions, that family pays attention instead to the child's behaviors. So if you're raised in an environment where the parents are only paying attention to your behavior, and let's say they want you to get straight A's, and you come home with straight A's and you get rewarded, good job, I'm so proud of you, or good job, here's a bigger allowance, or good job, here's a new bicycle. That then the person feels like they are rewarded for their behavior. They showed them something that they did, they got rewarded for it. However, if 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 the parent is not uh, able to understand that the child has emotions, and validate the child for their emotions. I used the example before. If the child is angry at the parent, and the parent threatens the child out of their anger, how dare you be angry with me? You don't know how good you have it, and they guilt the child out of their anger. Or you think you're going to be mad at me? I'll show you, and you go to bed hungry, or I'll show you, and I'm not going to drive you to your practice tomorrow. The parent has the control, and the child will then be intimidated and will begin to comply with their behavior, in order to not get punished, and that leaves the child's emotions out. So the child will then feel upset. The child will feel frustrated. The child will feel hurt. The child will feel angry, and the child will not be able to express those feelings because those feelings were overlooked or were condemned in their family.
Right. And expression of feeling within families, uh, for some families is easier than the other ones. For some families is very hard.
Mm-hmm.
And
Right.
usually some of these problems that we see in therapy come from families that they are expressionless. Their
Mm-hmm.
feelings are not expressed, or they are kind of, we see among families, we see that, mom, for example, they have a flat expression. Your own
Mm-hmm.
parents, they have kind of silent expression, and then children kind of don't know how to position themselves.
Mm-hmm. Right.
Because children, they act with their emotions, they act with their feelings,
Right.
right? And then because they don't have the practice of it, they don't know what to say about it, they don't know how to understand their own feelings, so they react about it,
Mm-hmm.
right? And then that reaction come across as bad behavior, and then the punishment comes in.
Right. So when the parent pays more attention to the child's behavior than to why the child is behaving that way,
Right.
which has to do with the child's feelings, children are mostly their feelings. That the intellect doesn't actually come online until much later. That's not to say that children don't have an intellect, but the adult way of processing things does not come online until the child is much older.
Right.
So the child still thinks like a child up until 10, 12, 15, sometimes 20 years old, and it takes a long time for the child to begin to mature into that adult thinking place. So what happens in codependency is that the child's feelings are invalidated or ignored. And ignored means that the child doesn't understand what their feelings are, or they don't understand what to do with their feelings, or they're invalidated by the parent, and so if the child is upset and crying, the parent will invalidate the child's feelings with common old statements like, "You cry and I'll give you something to cry about,"
Right.
which is to me the most ridiculous statement. However, it's pretty common, uh, because what that means is the parent is telling the child that I don't want to hear you cry, and my needs are more important than the fact that you're in pain. So you have to stifle your crying in order for you to meet my needs.
Exactly.
Now, why would a parent say something like that? And it's because the parent probably was told that themselves, but also the parent it doesn't is carrying a lot of unresolved sadness themselves, and when the child cries, it triggers the need to cry in the parent, and the parent doesn't feel the freedom to allow themselves to cry, so they repress it in the child. So the parent will try to say to the child, "Don't cry. I'm upset when you cry." Rather than say that, they threaten the child with, "You cry, and I'll give you something to cry about." So invalidation and repression of the child's inner life are what creates the codependency inside later on, because the child is trying to get their emotional needs met through another adult who's also wounded.
Right.
Yeah. Um, Inside of all of us, we have our authentic true selves. Our authentic true selves are authentic, have to do with our, our ability to connect with our authentic emotions about what's ever going on in our life. So I'll give an example, because I think my daughter is doing a wonderful job raising her two twin daughters who just turned 3. And so sometimes the daughters, of course, they're 3 years old, they get jealous of each other, and one sees one playing with a certain toy. Now, my daughter gets her children the same toy. So if there's a doll, she'll get the two of the same dolls, so that doesn't happen. But it doesn't always prevent it from happening,
Right.
because one child will see the doll that she wants being played with by the other one, and she doesn't want the other doll that my daughter bought. She wants the same
The
doll,
same doll.
right? So she will walk up sometimes and grab it out of the other one's hands. The other one then gets angry and will push or hit her, and then one of them ends up crying,
And then the chaos
and
happens.
then and then the breakdown starts happening.
Right.
So what my daughter now does at 3 years old, my granddaughters could certainly understand almost all of what's being said. She will say, "Listen, I want to talk to both of you," and she'll say, "Here's what happened." You know, my granddaughter's name is Sophie and Vivian. So she will say, "Well, here's what happened," and she'll talk to both of them. "Listen, Sophie, you had a doll, and Vivian wanted the doll that you had. And Vivian, you didn't walk up and ask Sophie if you could play with the doll. You just grabbed it from her. Sophie then got mad that you grabbed the doll, and then Sophie, you used your hands to express your anger and pushed Vivian, and then Vivian fell down and she got hurt, and you didn't use your words to say, 'I don't like that you took the doll away. And here's what I want you to do the next time. I want you to come to mommy if your feelings get hurt.'" Now, while she's telling them that, both of the children are looking away, and they're not paying attention. And so I said to my daughter, I said, one time explained, and 1,000 more times to explain,
Right.
right? But each time that she explains it, the children are hearing it, and it becomes a little more understandable, and eventually the children will be able to use their words and begin to work it out.
Exactly.
Well, we just got
We just got
notified.
notified that this is the end of our program, and we thank you for listening to us and joining us. Please call us. Let us know how do you benefit from this program and what else can we do for you. Our phone number is 951-922-3532, and also you can contact us privately. And don't forget, until next week, all you need is love, and happy 4th of July.
Happy 4th of July, and all you need is love.
Bye bye.
See you next week.